So confounding, that's the alternative explanation for an association found between an exposure and an outcome. So let's see. So we want to determine what a confounder is. We want to determine, so like I said, we want to look at confounding. So if we want to diagnose confounding and also see how we can control confounding. So there was they realized that people who drive Mercedes Benz they had permanent injuries, and those who did not drive Mercedes Benz but they drove other cars, a few of them had injuries, but those who drove the Mercedes Benz, most of them had permanent injuries. So they wanted to find out, is the Mercedes Benz so bad, or the safety, does Mercedes Benz have safety issues? Is Mercedes Benz having safety issues, so that those who drive Mercedes Benz end up getting problems with safety, like accidents and injuries with Mercedes Benz? So they want to find out. Mercedes Benz, over here the cases are 8 accidents, 8 injuries, but those who drove other cars, only 5 injuries out of 13 drivers. Then this is the control. So they found the odds of Mercedes, the odds of driving Mercedes Benz, or the odds of having permanent injury when you drive either Mercedes Benz or other cars. So we do the calculation, 8 times 7 all divided by 5 times 6, which gives us 1.87, or 8 divided by 5, then we bring the division sign, 6 divided by 7, so 8 divided by 5 is here, 6 divided by 7, then you divide all this by this to get 1.87. So 1.87, so there is what? The reference is 1. So if you are getting 1.87, then this is an increased odds ratio. Okay, so there is a risk over there. So they were complaining, so they wanted to even inform the Mercedes Benz that they should stop with the odds ratio of 1.87, that they should stop producing Mercedes Benz, or they should be careful of their cars because it's giving accidents and injuries. So the odds of finding someone who drives a Mercedes among the cases with permanent injuries is about 1.9. We extrapolated it to 1.9 times. That's almost twice the odds of finding someone that drives a Mercedes among the controls. So the controls was lower. So assuming this odds ratio is significant, then we have to advise the company that produces Mercedes Benz to urgently increase the safety from their cars, because it's giving people accidents. So let's see whether it's true. So scientists came, they gave the research, they awarded the research to a scientist and a professor, and this professor sought to investigate whether there is truth that Mercedes Benz is of low quality and giving accidents. So is there a difference in age? So the professor started by saying that, okay, those who drive the Mercedes Benz, what is their age category? So he stratified them into lower than 25 years and greater than 25 years. So when he did that, he saw that 69% of those who had accidents with the Mercedes Benz were younger people, and those who had accidents with Mercedes Benz who were older were only 31%, but the younger ones were high, that is 69%. So he came down to explain further that, so perhaps age could be a confounder of the relationship between the exposure to that's Mercedes-Benz getting accidents and Mercedes-Benz getting accidents. So how do we check if age was indeed what is causing the accident? So we see If you suspect confounding, you could control for it by analyzing in more or so we do stratification, analyzing in 2 or more strata. So this is called stratification. So we group the people into what? Younger than 25 years or younger age, and also older age that is greater than 25 years. So we stratify. So less than 25 years old, we saw that there were higher cases of permanent injuries by Mercedes-Benz. So 8 of them had accidents. But those who were older, those who had accidents with Mercedes-Benz were only 1. But the other cars rather were older. They had higher injuries in what? Those who drove other cars apart from Mercedes-Benz. So the odds ratio for the younger ones who drove the Mercedes-Benz were 1, and the older one, the older ones, most of them drove other cars, but not the Mercedes-Benz. So only 1 for Mercedes-Benz, and other cars like Toyota, Nissan, and the older one drove other cars. So you realize that the odds ratio for the older is also 1. 1 means that they are the same. There is no statistical significant difference. The odds ratio is the same. The risk is the same. So these odds ratio are called stratum specific odds ratio, and the odds ratio in the whole population is called the pooled odds ratio. What do the results? What does this results mean? This results means that age was a confounder for the found relationship between driving a Mercedes and permanent injuries. The ones driving the Mercedes were of an average or younger age than those driving the another car. That made it appear as if car type and outcome were associated, where in fact it was age and outcome. You realize that, you see, a young guy who has bought a Mercedes-Benz will drive it anyhow. You understand? But an old man who has bought a Mercedes-Benz will not drive it anyhow. So you see that the older people, the injury in younger people, that's less than 25 years, the injury was only 8. Those who were injured were only 8. But the adults, only 1 person was injured driving Mercedes-Benz. Meaning that, young guy who has bought a car, moving up and down, speeding, over speeding. So it's the age that was a confounder, causing a lot of injuries with Mercedes-Benz, but not the type of car that caused the accidents or the injury. So we realize that age is really a confounder. Age is really a confounder. So the risk of permanent injuries in drivers less than 25 years is higher than in drivers greater than 25 years. But it does not depend on the car type they are driving in stratum specific ratio. So it's not, you can drive your Nissan, you can drive your Corolla, you can drive any car, and you can drive Mercedes. Mercedes will not cause injuries to you. You can drive Corolla and have problems and have accidents based on the fact that you are reckless. And most of the young guys are reckless than the older ones. So age is a confounder over here. So that is why we did the stratification. We stratified into less than 25 years and greater than 25 years, and that will help us to find the truth of the association, that age is the problem and not the type of car. So we'd like to conclude by saying that with effect modification is important. Why is effect modification important? Because over here we finished talking about age is a confounder. So I've explained the Mercedes-Benz issue was about age, but when we come here, effect modification, that one is what I explained earlier on over here. I used this example to explain effect modification. That's high cholesterol level, malaria, killing pregnant women, measles, killing malnourished children. That is modification, effect modification. So I'd like to conclude by saying that effect modification is very important in clinical studies because it allows us to define high-risk subgroups. So effect modification helps us to define high-risk subgroups, because you can see over here that pregnant women are at a very high risk of what? Getting, let's see, effect modification. Yes, so pregnant women, you see, cholesterol, those with high cholesterol have a high risk of getting myocardial infarction. Those with hypertension with high cholesterol level have high risk of getting myocardial infarction. Whereas malaria patients who die were mostly pregnant women because they have weak immune system because of their confounding influence of pregnancy. Measles causes more deaths in malnourished children. So malnutrition predisposes to what? Death from measles. So that is measles, malnutrition, pregnancy, and high cholesterol levels in the blood are effect modified. They increase the risk of getting the outcome of the disease. So we like to conclude on them that they define high risk groups. So the effect modifiers help us to identify which category of people are highly predisposed to a condition. So it helps us also to take preventive measures, because if high cholesterol level is giving hypertensive myocardial infarction, then if you remove or control the level of cholesterol you take into your body, then it will prevent or protect you from getting myocardial infarction. And its effect modifiers help us to more precisely estimate an effect, and it helps us to conduct meaningful comparisons among different studies that might have different proportions of effect modification. So cholesterol, hypertensives with cholesterol, and hypertensives who smoke, which of them will lead to what? Myocardial infarction. It can also be crucial to medical research, as it gives a starting point for developing a causal hypothesis for disorder. So causality is very important. What causes what? So if the effect modifier is there, we'll know that cholesterol, which is an effect modifier for myocardial infarction in hypertensives, will help us to really establish the appropriate cause for myocardial infarction in hypertensives. Without much ado, I would like to end the class here. And if you have any other questions that you would like me to address, then we have to meet in class so that we address these concerns. So without much ado, I would like to say thank you for being my audience. Thank you, Lord.